Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to the Tech Blog Writer Podcast. I'm so excited today because we've had a record-breaking month in September. I've just looked back at last month's stats and it appeared an additional 12,000 of you appeared from nowhere. So if you're one of those 12,000 new listeners joining our global community of listeners from 165 different countries, learning from real-world examples of how technology is transforming businesses and multiple industries every day, a big, big warm welcome from me. And I do know there are a lot of you this month, but I wanted you all to know that what's different about this podcast is, yes, I'm going to share my opinions about tech, and we're going to have a different guest on this show every single day, sharing their opinions too. But most importantly, I invite every single listener to share their opinions, their insights, their experiences too. So for future reference, email me anytime, techblogwriter@outlook.com, tweet me at Neil C. Hughes, and you can also pop by my website, techblogwriter.co.uk. If you go to podcasts, you can leave me a virtual voicemail by simply just pushing a button and recording your message. I consider myself the easiest guy in the world to get hold of, and I want you to feel a part of this podcast too. Because if you're going to be listening to this show every single day and it almost becomes the soundtrack to your life, I don't want you just passively listening. I want to hear what you think. I want to hear your opinions because I'm sure you've got so much valuable input that you could add too. And if you like the show, why not leave a review on iTunes too? Because it will also bring more like-minded souls like you over to our little tech community. But most importantly, let me know how you found me, where you listen, or indeed anything at all. I could talk to you guys all day, but we do have a guest waiting to speak with us today. So maybe we should get on with today's show. I recently discovered a company that highlighted how text messaging has the potential to save millions of lives and billions in healthcare costs, all by ensuring patients adhere to their prescriptions. But that's just the tip of the iceberg and also what they do. For example, did you know that non-adherence accounts for upwards of 50% of doctors' visits, 40% of long-term care admissions, and more than 50% of hospital readmissions? And technology offers so many simple solutions to a devastating problem, especially for managing chronic conditions like diabetes, hypertension, and mental health disorders. So I wanted to find out more about how technology can change things for the better. So I invited Curaizon's CEO, Nicholas Rumble, onto today's show to talk about how Curaizon's approach to tackling this critical challenge could help transform healthcare. So buckle up and hold on tight as I beam your ears all the way to Copenhagen in Denmark so we can speak with Nicholas James Rumble from Curaizon. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Well, thank you for having me. My name is Nicholas. I am the founder and CEO of Curaizon. We are a healthcare technology company, and we provide drug adherence technologies and big data solutions to the world. We're working primarily in the area of drug adherence and also in working with pharmaceutical industry and other researchers, academia and so on, in trying to improve patient outcomes, treatment and therapy guidelines. As I guess our maxim really is that improving healthcare, reducing costs and saving lives is what we're all about.
So when I was reading about you guys, I quickly came across Curaserve technology in Curaizon, and it helps to ensure that patients are taking their medicines as prescribed by their doctor. But can you just tell everyone listening about how you're leveraging technology to help patients live longer and having healthier lives as a result of that?
Sure. Well, the headline statistics are fairly clear and make for some alarming reading, actually. Chronic disease and long-term illnesses such as diabetes, asthma, heart disease, hypertension, cancer, etc. These now affect half of all adults in the West. And the problem is further exacerbated by non-adherence. So it's estimated that between 50 and 75% of people suffering from long-term or chronic illness fail to take their medication as prescribed, which makes drug non-adherence the fourth biggest killer globally, and it leads to more than $700 billion in avoidable healthcare costs annually. And that's not to mention the $630 billion each year that the pharmaceutical industry loses in lost revenue. So we utilize the best distribution channel to notify patients to take their medication on time every time. And then we escalate non-adherence when it occurs to their emergency contact. So we're thereby engaging family members and as a stakeholder in the chain of care. So one of the things we know is that while we can be positively negligent of our own care, we're very much better at taking care of those we love. So by doing this, we see huge increases in adherence levels, and therefore we can reduce the burden upon healthcare providers. Engaging with technology is really the most effective way for a patient to improve disease management, and here at Curaizon, we're really on the cutting edge of this smart health revolution.
I read a great quote on your Twitter feed recently, which was, if adherence therapy was a new drug, it would be hailed as a potentially major advancement in medical treatment. And just reading that, it was something that really resonated with me. And I think it's an incredibly refreshing way to look at how to improve healthcare whilst also reducing costs and saving lives at the same time. But how accepting have the healthcare industry been to this approach, and what kind of feedback have you been getting?
Yeah, it's a great question. So, I mean, first of all, the quote that you mentioned, that was from Professor Richard Gray, actually. He works for the Nuffield Department of Population Health in their Clinical Trial Service and Epidemiological Studies Unit. So he's right at the forefront of this, and he's absolutely right, of course. So, for example, in very simplistic terms, if we were to increase the adherence of type 2 diabetics in the UK by, say, 10%, the National Health Service would reduce their costs by more than £2 billion per year and save numerous lives. So our expectation is we can increase this by as much as 37%. So you can see very quickly how a small input from our side in improving adherence can have a very significant impact in both the costs for the providers of the health services and also the patients themselves. In terms of the latter part of your question, we've been very encouraged by the response and feedback. I guess the important thing to remember is that the health services are no stranger to this problem. They've unfortunately been very aware and seen the sort of terrible outcomes that drug non-adherence causes. So they're naturally very happy to see that something's being done. With respect to our technology, they've seen it as the first truly scalable and implementable solution to this problem. So right now, we're trying to keep up with demand. I mean, part of our fundraising activities are so that we can deliver this to more countries in a shorter time frame. But widely well received. Many have tried and many have failed to generate a system or a service that delivers the kind of change and impacts that we do. And by having this fully integrated solution as we do, we're able to actually affect those changes that we speak about in our materials.
And there are so many great stats that support this too. I mean, correct me if I'm wrong, but am I right in saying that non-adherence accounts for up to 50% of doctor visits, 40% of long-term admissions? Because if that's the case, it seems like the problem is staggering, isn't it?
Well, you're right, and actually it's worse than that. I mean, also half of all hospital readmissions is included in that statistic. So it's staggering. I was first introduced to this problem by a friend some years ago, and when he told me, he gave me some insight into the numbers behind this, and I was in utter disbelief. And I then set about doing nearly 2 years worth of research into this and discovering that he was wrong. It was actually much worse than he was suggesting to me. So, I mean, you talk about 50% of visits to a doctor, 40% of long-term care admissions, and as I mentioned, half of all hospital readmissions is a direct result of non-adherence. But let's not forget that both the visits to a doctor or admissions to a hospital, they're totally avoidable. So if a patient is able to gain control over their disease, most of the disease classes we work with are eminently treatable with medication. So by freeing up these resources, we're able to deploy them to patients that need them the most. So as it stands right now, the hospital bed's being taken by a patient that's just not taking their medications correctly and therefore managing their disease. That's a bed that could be used by a child or a sick elderly person that really needs those resources. So the problem is very massive, and it has two very clear, distinctive aspects to it. One is, of course, the personal cost, the loss of lives, the disabilities that come from this. An example would be diabetic patient that mismanages their disease and as a result loses their eyesight or loses a foot, and then instead of supporting their family and contributing to society, they become dependent on the state, they become dependent on welfare, they can't support their family, they can't work, they are a disabled person and require additional care, which of course costs money. It's an impact on the family in a larger viewpoint. So it really has significant impact on the personal side, but also the cost aspect is absolutely enormous. So, like I said, $700 billion per year in avoidable healthcare costs. This is waste that we just need to cut back on because, to my mind, there isn't a health service in the developed world that is underfunded. It's just very poor at managing waste in this way. So if we could reduce waste in the health service by 10 or 20 billion pounds per year, which is very achievable, then that money could be deployed in the way that we actually want it to be deployed to care and to improve the lives of and care for people that need it the most.
So if possible, I just want to take you back in time for a few moments. So can you tell me a little bit more about the story behind Curaizon and what put you on this journey?
It's very interesting. Like I said, I have a friend that was working in the healthcare sector in the United States, and this has obviously been, a big problem for them too. Drug adherence is not geographically specific. It affects everybody in the world that's on some kind of long-term medication. So after speaking to him and being bewildered by the sheer scale of the problem, I set about thinking how I could address this. So I've been personally affected by this too, but I suppose my background is from investment banking. I worked in investment banking for the majority of my adult life, but I left that world more than 6 years ago now to pursue this vision of trying to fix this massive societal problem. I guess I don't like when things don't work. I have this engineer's mentality where there has to be a better way. There needs to be a solution to almost every problem. And so using that train of thought and the technical and business skills, I suppose, that I have, I went off on this journey to try and find a solution to this, and now we have. So I was convinced we could solve this problem, and it's turned out that we've done precisely that.
Fantastic. So can you tell me more about the technology? Well, I believe it's possible for patients to log into their own dashboards and accounts, or via an app or the web, and immediately see their progress and status. It sounds fantastic what you're doing here.
That's precisely right. That's exactly what they can do. We really want to put the patients and their families back in control. So by accessing their profile via both our native apps or the web-based dashboards, they can see in real time their own adherence levels, and then they can benchmark themselves against their peers. And I suppose this level of gamification, for want of a better word, has been shown to really enhance both our technology and drive greater use and adoption. So it allows patients to see their charitable donations in addition. So as a company, we donate 10% of our profits to charities and research organizations that are allied to the patient's disease. So every time a patient engages with our technology, some of the revenue that we generate from that is automatically donated to a charity of their choosing and nominally associated with a research organization that's helping find better treatments and even cures for the disease that they're suffering from.
So when you set out to solve these problems that we've discussed today, why did you choose blockchain, and what benefits does that provide that's not possible with the more, let's say, traditional solutions out there?
It's a good question. The blockchain has revolutionized a great many things, but for us, we saw it as an absolute necessity to deliver the kind of immutability and security and transparency that we wanted to deliver to the patients. So we only deal with anonymized data, but while we store our data in an appropriate cloud domain, we use the blockchain to allow patients to control rights and permissions of how and when their data is used. I guess by doing this, we can continue to incentivize those patients for each time we utilize their data for research and clinical purposes. And really, this is only possible by employing the blockchain. It's the only way that we can deliver those kind of controls and securities and transparency to the patient.
So what's the role of the token, and why is that needed? And also, of course, what made you choose that ICO route?
That's fairly simple. The only way to access our data is via our token.
Yeah.
So we saw this as a smart way to manage the utility and maintain controls over the data use, which is to say that we only make our data available and the analytics that sit behind that available to researchers, such as those working within the pharmaceutical industry and academia. So we don't share our data with anyone that isn't contributing to the betterment of drug discovery or improved therapies and related research. The ICO, I guess, was a natural fit for our goals, both in terms of the tokenization of our data and the funding avenues that it opened up and offered to us.
I love how you're solving real problems by leveraging technology, but the main problem I see you coming across, I would imagine, is how you're going to secure real-world adoption. So how are you going to tackle that issue, and are there any partnerships that you can share? I know it's early days yet, and there's probably a lot that you can't share with me, but is there anything that you can?
Well, on the adoption side, that's actually been a lot easier than we expected. We're unique in our space in that we don't have any direct competitors. So really, there's only one choice. You either want to address adherence in a cost-effective way, or you want to continue with the status quo. And so, naturally, from that, health services are wanting to engage. They are there to deliver, improved quality outcomes, delivery of care, and trying to reduce this waste that we've spoken about, and of course, saving of lives. So we can deliver on all of those fronts. So it's an easy win from them. As one of the commissioners from the National Health Service said to me, this was like being offered a cheap cure for cancer. It's a no-brainer. It has to be done. It's something that we need to do. And it's only a shame that it's taken this long for someone to come up with a viable solution that can deliver against the targets and aims of addressing drug non-adherence. Oh, sorry, and you also asked me about partnerships. So, to be perfectly frank with you, there are some announcements coming up in the coming weeks, but there's nothing that I can share at this time because it's kind of sensitive in terms of the announcements, because there's some legal issues that still need to be in place. But we have some significant updates or announcements to make with respect to partnerships, both on the pharmaceutical side and drug discovery side, but also in licensing of our technology in other parts of the world.
Excellent. I do love a good teaser. Sounds like we're going to have to get you back in another 3 or 6 months there to find out more.
Have to come back anytime.
So in the next 12 to 18 months, what are your big goals or objectives that you're aiming for at the moment?
Well, there's an awful lot to do, as is always the case with a company like ours, both in terms of the stage that we're at and also the technology that we're employing and the markets that we're trying to deploy it into. So it's a pretty busy time for us. So I guess the primary focus is on the next generation of development of our technologies, and then the penetration into our key target markets. And some of that will be via these partnerships that I just didn't mention and couldn't really tell you about. So yeah, the ongoing evolution and development of the technology, and then further penetration and subject to the finance being in place, then we can just ramp up that penetration even more quickly.
Well, a huge thank you for taking the time to come and speak with me today. But before I do let you go, could I just ask that you remind the listeners of where they can find you guys online, find out more about the project, maybe download white papers and just find out more information, or equally just contact a member of your team if they have any questions after listening to our conversation today? Absolutely.
Well, we can be contacted at info@Curaizon.com, and Curaizon is spelled Curaizon. That's monitored 24/7 by our team of moderators, so they will make sure that any inquiry goes to the relevant team member, and you'll get a response pretty rapidly. But in terms of our ICO, more information can be found at curatoken.curaizon.com. Our white paper is downloadable in multiple languages, and there's a lot more information and videos where you can find out more about our project. And we welcome any input or inquiries from anybody, whether it be investors or partners or anyone else in between. So, absolute pleasure to speak with you, and thanks for taking the time.
Well, I always say at the end of every episode that technology works best when it brings people together. But what you're doing here is you're solving a real-world problem and actually improving healthcare, reducing costs and saving lives all at the same time using technology, which is a fantastic thing. So I applaud you for that. And hopefully we'll get you back on in 3 or 6 months and follow your journey with you. But a big thank you for coming on and talking with me today.
Thanks a lot, Neil. It was my pleasure also. Thank you so much.
The quote towards the beginning of this episode, if adherence therapy was a new drug, it would be hailed as a potentially major advance in medical treatment, really, really resonated with me. And I find myself fascinated by this alternative but blindingly obvious approach by leveraging technology to help patients live longer and have healthier lives. And I was equally curious about why they're choosing blockchain to solve these problems and also how they're going to secure real-world adoption. So I cannot thank Nicholas enough for coming on today and telling us about this great work that he's doing. But I would love to hear your takeaways from today's conversation and your thoughts and your insights. And this is where I say it's open mic time. I'm going to pass the virtual mic over to you because on the show, anybody is free to step up. And I really, really hope that you share your opinions on this episode or, in fact, any of the episodes that we publish each week. Because for this podcast to work, we need opinions from all sides for a balanced debate on how we can actually improve things by leveraging technology. So remember, as I said at the beginning of the show, email me techblogwriter@outlook.com or tweet me at Neil C. Hughes. Finally, a big warm thank you from me to you for having you choose this podcast to accompany you for 20-25 minutes every day, wherever you're listening to this show. So keep those messages coming in. I will return again tomorrow with another great guest of how technology is transforming another industry. And I look forward to doing it all again with you. So a big thank you for listening. And until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.